Greetings and thank you all for joining us today for this historic announcement. During today's announcement, you will hear from our national leaders, mayors, and one of our philanthropic partners about this new initiative. My name is Anthony Smith. I'm the Executive Director for Cities United, and it is my honor to introduce you to the Coalition to Advance Public Safety, our CAPS, as we call it, called the initiative. The Coalition to Advance Public Safety is a strategic partnership between 4 national recognized and Black-led organizations that are committed to ending community violence, gun violence in our cities, and partnering with those who are most impacted. The organizations that comprise CAPS are the Coalition to Advance Public Safety, as the Health Alliance for Violence Intervention, or the HAVI, the National Institute for Criminal Justice and Reform, the Community-Based Public Safety Collective, and Cities United. All of us previously served as the training and technical assistance providers to the recently concluded 18-month White House initiative, Community Violence Intervention Collaborative. The new CAPS initiative will build on the lessons learned and the strategies utilized to support the civic work that we just completed with the White House, to expand on the ongoing work with mayors and community members across the country that systematically deploy training and technical assistance to cities with high rates of gun violence. Our first cohort of cities will be Newark, Baltimore, Baton Rouge, and Indianapolis. These cities will begin their work this month in partnership with the CAPS Collaborative to scale up and bring cohesive and additional funding to their local communities and community violence intervention ecosystems. Over the next 4 years, the Coalition to Advance Public Safety would partner with 12 cities, adding 4 new cities each year. CAPS will work with mayors, local community-based organizations, and hospitals to enhance their collective efforts to identify, engage, and support those most at risk of being impacted by community gun violence. The goals for our first cohort is to reduce gun homicides and non-fatal shootings by 20% over the next 4 years. A little bit about Cities United. Cities United partners with mayors, community members, and young leaders across the country, helping them to develop comprehensive public safety strategies to reduce the homicide rate of young Black men and boys ages 14 to 24. We work in partnership with mayors and other local elected officials to make sure that they can help, that they have the resources that they need to best support the community violence ecosystems in their city. And we partner with our 4 agencies and the 4 partners. It is important, and this is an announcement, it's important because the 4 of us all have different lenses and we all come from this work at different places. You will hear from Akila and Fatima, and they'll talk a little bit more about their organizations and what they bring. But before I turn it over to Akila, I want to give a special thank you to our funder partners, the Bomber Group and the Schusterman Foundation, for their continued support of our collective work and that our continued partnership. And now with that, I want to turn it over to Akila, the Executive Director of the Community-Based Public Safety Collective, to talk about the importance of capacity building for local CVI organizations and the need for national support for CVI as a complementary strategy to policing. Akila?
Anthony, thank you so much. So excited to be here today with all of you family. Traditionally, law enforcement has been viewed as a single ubiquitous institution that's responsible for safety in our communities. Traditionally, you say public safety and people will respond police. But the public execution of George Floyd was a real inflection point for us. It signaled to us that we must reimagine public safety as a shared strategy that includes the public as a paid partner in our new public safety ecosystem, because you literally cannot have public safety without the public. So CVI, or community-based public safety, has been reducing violence in urban communities for close to 30 years. The work is evidence-based, it's data-informed. However, CVI ecosystems are historically underfunded and fragmented. So CAP's focus will be to build CVI organizational infrastructure, both physically and programmatically, to serve as a core partner in your city's public safety strategy. The CVI ecosystem represents a set of resources and strategies to address violence that are complementary to existing law enforcement, not an alternative, and also to social services and other municipal entities. The CVI does not seek to disrupt nor displace any resources, but to unite the entire community in an effort to eliminate violence as a public health issue. So CAPS will provide about $500,000 in capacity building grants to targeted CVI partners in your city to strengthen and enhance their existing work. Systems like high-risk intervention or hospital-based violence intervention, right? Teachable moments when people are harmed, and these community health workers come bedside to help them to make better decisions about their life as they're transitioning into communities. Trauma recovery centers, helping people to address the underlying trauma that they experience, because as we know, violence is about proximity, and trauma and poverty is the things that actually exacerbates it. Non-law enforcement responses to OD, safe passage, victims advocacy, all of these initiatives, are happening, and are focused through a public health lens and through a trauma-informed approach. So we will organize with this investment in your city, peer exchanges and webinars. We'll do webinars on organizational essentials all the way to data management, right? We'll do trainings and certifications for your boots on the ground strategy, so that we're operating with standard operating procedures and protocols across the movement. No matter what city you go to, whether it's Newark or LA, a 211 is a 211. Whether it's in Memphis or Chicago, a 187 is a 187, right? So we want to develop language across the CVI ecosystem and movement so that folks are all speaking a similar language. We also want to invest in participatory research and evaluation, because as we are growing this movement, we want to make sure that we're documenting the impact, so that we can work together to move more public support in municipal dollars to be able to support this work going forward. And with that, I just wanted to say that the Community-Based Public Safety Collective is a Newark-based agency that's doing training and technical assistance nationally. We see ourselves as a group of experts who are experts in the field of community violence intervention, of victims advocacy. We do education, we do capacity building for organizations, and we are just excited to be a core partner in this strategy with you to be able to improve safety in your city and reduce violence. I also would be remiss, just to not say that I want to lift up our local philanthropies, Prudential Foundation, Victoria Foundation, for your investment in the city of Newark, because you have been a core partner in helping to incubate and innovate our community violence intervention strategy that has led to multiple years of decreases in violence and homicide at the leadership of our visionary leader, Mayor Ras J. Baraka. And so with that, I want to turn it back over to my brother Anthony, and look forward to answering questions a little later on in the press.
Thank you, Akila. I appreciate that. And before I bring up our next speaker, I do want to say to the press who is on, we will have Q&A at the end. You will be using the Q&A box to ask questions. So if you are here from the press, please make sure that you use the Q&A box to be prepared to ask questions. Thank you. And with that, I want to turn it over to Mayor Baraka from Newark, New Jersey, to talk about the work that he's been leading in Newark and the success, the importance of investing in the ecosystem, and then how all those investments improving public safety in Newark. Mayor Baraka.
Thank you. I appreciate being on today. It is a very historic time period in this country when we're beginning to put public back in public safety. In 2014, when I took office as the mayor of the city, we worked with Rutgers University immediately to create a public safety strategy. They created something called the Safer Newark Council. They created a report which basically told us where violence and crime was happening the most in the city, and buttressed the idea that violence and crime was a public health issue, was something that moved around, and if we dealt with it in terms of public health, that we could have serious impact on the level of violence and crime and how it's spreading throughout our city. As a result of that, I reached out to Akila Sherrills, who was an old friend in this area, working across the country, particularly in LA then, to come to Newark and create a public safety infrastructure for us, a system and then turn it over to the local folks. And out of that came the Newark Community Street Team, which is probably one of the most successful CVI organizations that exist in the country now. And since then, we launched the Office of Violence Prevention and Trauma Recovery, which is a city-based agency that begins to oversee our public safety strategy, our community violence intervention strategy, our strategy that deals with civilians. And we also launched what we call the Brick City Peace Collective, which became the convener of community-based organizations that did this work, to professionalize the work, to track the data around this work, and to get people to work together in a larger ecosystem to challenge the old ideas of how we reduce violence and crime and begin to really, really have impact on the serious areas in our city that were experiencing most of the violence and most of the crime, and particularly treat trauma right away. I'm excited about what CAPS offers here. Many Black and Brown organizations are led by Black and Brown people in these communities fighting this fight. Don't usually have the resources and the support that they need. So this gives us an opportunity to supplement what we're doing on a municipal level, some of the things that are happening on a state level, and resources that are coming together around this to begin to focus and channel those resources into the right organizations and the right folks that are closer to the problem that can get this solved. And I think as a result of all of that, Newark last year announced about 60-year low in the level of homicides and violence in our city. We have been trending downward for a long period of time. It doesn't mean that we don't have issues. It means that we are doing a lot better at it than we have been before. And I can attribute that to the ecosystem and the collaboration that we have between our Newark police and our community-based organizations, our community violence intervention strategy that we've put together, a larger ecosystem that we invest in very deliberately and intentionally. And in the next couple of weeks, we will be putting out an RFP for millions of more dollars that we would put in the hands of some of these community-based organizations to continue the great work that they've been doing alongside of the police. And I'd like to close. Last night, I was at an event where the new police officers that just came out of the academy, that have been moving into the streets, that have already been sent to their precincts, had a community-based meeting with community organizations and community activists where they introduced themselves to the community, what precinct they came from, where they were born and raised, and why they want to become police officers. And that kind of further, solidifies our relationship with the community and allows them to meet not only the community, but also the CVI organizations and folks that are working, that they're going to be working alongside of to further this ecosystem that we created and we tout here in the city of Newark. So I'm here to answer any questions that folks have, and I appreciate being called on to be a part of what's going on.
No, we appreciate you, Mayor, and thank you for that overview, and thank you for your leadership. And thank you for putting a pin on the importance of this Black and Brown-led initiative that is CAPS. With that, I want to bring on Mayor Brandon Scott from Baltimore to talk about the successes that they have been seeing in the work, but also the importance of funding the expanding of CVI in Baltimore. Mayor Scott, good to see you.
Thank you. Good to see you, Anthony. Good to be with everyone. And always great to follow my big brother, Mayor Baraka, who's been a trailblazer and leading in this work for quite some time. And thank you, everybody, for having me. I think it's no secret to everyone here that since 2015, and quite honestly, for most of my life, my city, Baltimore, has experienced the loss of more than 300 people per year as a result of gun violence. And like so many, I'm constantly thinking about the families and communities that are forever going to be impacted by such tragic loss. And to be quite frank, experiencing that loss firsthand as a young man growing up in Baltimore in the 80s and the 90s is what fueled me to public service. But it also fuels our collective determination and commitment to tackle violence on our streets for and as the health public epidemic that it is. Historically, like you just heard from my brother Mayor, Baltimore, like cities across the country, over-relied on what we call the 3 Ps, policing, prosecutions, and prison, in an attempt to reduce violence and strengthen community safety. That strategy was never the right one, and it has not only failed to yield long-term results, it has also come at an extremely high cost to so many of our most vulnerable communities. But we know, and as my grandmother would say, when you know better, you do better. And we know that in order to reduce violence, Baltimore's capacity to transform conflict positively and reduce violence has to drastically expand. And treating violence as a public health crisis means that we must develop public safety infrastructure that recognizes that acts of violence don't start or end when someone pulls a trigger. Last year, we developed and put out our first ever comprehensive violence prevention plan and our framework for our community violence intervention ecosystem here in Baltimore. We know is a nationally recognized approach to public safety that combines violence intervention programming like our flagship SLIP program, Safe Streets, and community-based organizations with integrated victim services. And I want to park there for a second because when I became mayor, and until we did this big movement last year, people that were gunshot victims in Baltimore City weren't even eligible for victim services. Now, those services have been expanded to them. And we know that goes along with intensive life coaching, hospital-based intervention, school-based intervention at our most chronically violent high schools, and other wraparound support. That also includes for us a stronger support and oversight for our Safe Streets program. And as at the end of 2022, our Safe Streets violence intervention workers had mediated 2,200 potentially violent conflicts. And that is just the beginning, because now we are making those historic investments. Last year, I announced that I was spending $50 million of my American Rescue Plan funding to fund this work. Because in order for us to truly take this approach, it's going to cost money. And tackling a public health approach to Baltimore's violence epidemic is my top responsibility as mayor. And the dollars that we invest in CVI and public safety practices that are rooted in equity, healing, public health, trauma-informed practices, and quite frankly, rooted in the community, will help us build safer neighborhoods today and achieve the sustainable reductions in violence over time. And we're already seeing a deep impact that now that our ecosystem is growing. We kicked off last year with our group violence reduction strategy, where we are taking resources to the folks who are the most likely to end up the victim or the person pulling that trigger, and telling them, like, we will get you whatever you need. In West Baltimore, the Western Police District, the home of Freddie Gray, the home of The Wire, the home of The Corner, the home of Homicide, Life on the Street, or whatever TV show you've seen about Baltimore. And with this approach, a both and approach, right? Allowing our police department to focus on the things that they should be focused on, and allowing our CVI work, our community work, our partners work to focus on the things that they should be focused on. We saw a 30% reduction in that district last year. And now we're expanding that work across our city. And we know that we have a lot of work to do, even though we are right now down 27% year over year for homicides in the city. I am excited to welcome the Coalition to Advance Public Safety, my partners in this work to save our communities, to Baltimore, but also that we have to scale up this work and continue to build up these ecosystems across the country so that we can truly produce the best outcomes for our residents. Because when you hear the stories, when you talk to young women and young men who were on the fritz, they could have very likely ended up the victim of violence, and now they're working, now they're getting their behavioral health, their substance abuse help that they need. They have a roof over their head, right? That work is done because people that they respect in the community, folks that they know have that credibility with our community, have been able to bring them in. That's how we're going to do this approach and grow it in a way that we know that we need to. We have to continue to invest. That $50 million, as I always say, is just a down payment because we're committed to growing our ecosystem with all of our partners here in the city of Baltimore to the highest heights so that we can become the best and most safe city that we can be. Thank you.
No, thank you, Mayor Scott, for that. And thank you for your investment. And thank you for bringing in the men and women who we're talking about and are all working for. So appreciate your energy and appreciate your efforts. So thank you, sir. I will hold for more questions later. Next, I want to bring in Mayor Broom from the great city of Baton Rouge, where I'm happen to be at today. to really talk about some of the challenges that we see, but also optimism for CVI, community violence intervention, as we move forward. Mayor Broome, so good to see you. I turn it over to you.
So good to see you, Anthony, and thank you. We're delighted to have you here in the city of Baton Rouge. And to my colleagues, Mayor Baraka and Mayor Scott, certainly good to be on this call with you all as well. I am so proud and thankful of the growth and collaboration from all sides to bring this new partnership to reality. I have to tell you, today, I have a 9-year-old brilliant young woman who is off school today and wanted to spend her day off shadowing her mayor, Zoe Jenkins. And I am happy she's here because she gets to witness how we are working to make her future safe here in Baton Rouge. It feels like just yesterday, Anthony, that you joined me in Baton Rouge and we signed on with Cities United to build a roadmap for community-based public safety. And it has been 4 years since we pledged with Cities United. Akila, of course, our team tells me about the advancements we're making day to day. And I personally want to thank you and all the partners here for your ongoing support of Baton Rouge. It is making a difference. It's no secret how much our team works hand in hand with each of your partner organizations. And I hope you all feel equally a part of our team. Last year, Baton Rouge saw a 23% reduction in homicides and 14% reduction in non-fatal shootings. This was only possible because of the on-the-ground support you all gave our senior team and our community-based organizations to put solutions to work. The complexity of violence can't be adequately addressed without the trust, the buy-in, and partnership of the communities that are most affected by violence. So this work will not yield the long-term results without their assistance. We need to have community members always at the table so they understand and are part of us building a safe, hopeful, and healthy community. You know, during our recent MLK Day service, I shared my belief in conscientious citizenship. Our residents in every city need to be actively engaged politically, civically, community, and culturally in their spaces. Everyone should pay attention. Everyone needs to be informed, and they need to get to work in their sphere of influence. The CAPS partnership with our local community-based organization does just that. Over the last 18 months, our core 4 organizations have participated in bi-weekly meetings that I believe are key to our success in reducing violence. This investment for ongoing support will be vital in continuing the necessary capacity building to expand from 2 of our high violence areas to covering 12 key neighborhoods. This multi-year investment will also address one of the challenges local government always faces, and that challenge is one of sustainability. Having the support of CAPS in Baton Rouge will also advance our data sharing and accessibility for our high-risk interventionists. We are leveraging our data to create smart solutions. And with this support, we will have national experts working with our local data analysts to guide where we need to respond. Personally, I am very enthusiastic about having peer cities that our team can learn from and build with. I believe that this partnership will be a game changer for our victims and violence impacted communities. We have been working on mobile trauma recovery centers and HVIP services. My goal this year is to have mobile units that touch the heart of the needs of our communities. Baton Rouge is excited to join this cohort, and we are ready to continue the work. Thank you so much.
Thank you, Mayor Broome, and thank you for that Sankofa moment, taking us back 4 years as we look ahead and look for the future. So I appreciate that. And I know Mardi Gras is this week, so we appreciate you for making time and space as we come to Baton Rouge, and look forward to the partnership. Before I turn it over to Fatima from the Health Alliance for Violence Intervention, I do want to say that the fourth city that we're going to be working with is Indianapolis. The mayor cannot join us today, but they are just as committed as you've heard from the last 3 mayors to really being a partner with us as we build this work out. So I want to turn it over to Fatima to really talk us through the CVI ecosystem, a new site that we have been working out, that we're rolling out today. So Fatima, I'm gonna turn it over to you.
Thank you so much, Anthony. And I want to just extend my deepest gratitude to the mayors who are on this call, my fellow partners, and to our funders, and to all of you, our wider community. You as stakeholders engaged listening are critical for our success. My name is Fatima Loren-Dreyer. I'm Executive Director of the Health Alliance for Violence Intervention, and want to just share a bit about our work to come. First, just a bit about the HAVI. We are the only national organization that helps stand up hospital-based violence intervention. We support over 85 cities, build thriving community hospital partnerships to address community violence. And I want to spend some time just with a few slides here, sharing a bit about the data and science that undergirds the CAPS initiative. The first, I think, important thing for you all to understand is that violence, community violence in particular, is highly concentrated. And so 2015 analysis found that 50% of homicides in the entire United States are concentrated within 127 cities. And then within those cities, it's not just evenly distributed across the city. Violence is further concentrated in specific disinvested neighborhoods where there's been structural neglect. And even within those neighborhoods, it's only a fraction of a percent of individuals who are, again, through neglect, caught in cycles of violence. So there are structural problems, and they can be addressed with structural and targeted interventions. So we can actually end community violence, but it takes a very clear and decisive strategy. And I'm proud to announce that we've launched CVIecosystem.org to help guide that strategy. First, I want to just share a little bit about CAPS theory of change, and you heard my fellow partners share this. Our theory of change is that we can reduce near-term shootings and homicides by 20% in 12 cities, and we can do so through a series of data-driven, very targeted opportunities to engage across the ecosystem. We have to identify those who are at greatest risk. We want to ensure that we're financing community violence intervention and supporting the professionalization and certification of staff. We need effective management and ensuring that those who are participating in our programs are rigorously engaged. We want to ensure that all stakeholders, not just those who are actively engaged in intervention, but community partners are also aligned with this strategy, understand it in the ways that we've described here. We want to ensure that wraparound care, like employment, housing, that those are also aligned and supporting the initiative. We care deeply about deep, rigorous evaluation and changing the narrative. And again, all the speakers before me have really demonstrated each of these pieces of the theory of change. We've talked about the community violence intervention ecosystem, and on the website, you will see it laid out in this graphic to clarify that when we say ecosystem, we truly mean a range of strategies that have been deployed in different states across the country. The key thing to understand here is coordination of these strategies, that we're not simply pulling out one or the other, but we are ensuring that many of these strategies exist and that they are deeply connected to one another, and that they're engaged in an overall focus on reducing violence. So this is critical for our success. I now want to share a few screenshots from the CVI ecosystem website. Again, you can go to cviecosystem.org. On my upper left, you will see our homepage. And there's some verbiage there to explain what CVI ecosystem is. And you will be able to select from among 50 cities with high violence rates, a profile that will be generated that shares the following. And I'm going to walk you through what these profiles will offer. So we have here on a screenshot of Indianapolis. When you get to, if you were to select Indianapolis, you would see first in the upper right-hand corner, a total annual recommended budget. This is recommended that we believe will really put a significant dent in community violence reduction work by the deployment of these strategies. And if there are any reports relevant for community violence intervention, those are stated at the top. And we're on an ongoing basis, we'll update those reports. At the top right of my screen, you'll see ongoing data about Indianapolis, its population size. We also offer an estimate of the population at highest risk for near-term violence. And we define near-term violence as violence that might happen today through the next 18 months. And then finally, the number of homicides. If these are source data points, you will see the source. If they're estimates, they are clearly labeled estimates. And this is important because our methodology is based on experience that we collectively at CAPS have had over decades of experience with violence reduction strategy. But these projections are really still based on analyses that is ongoing. So as we refine our analyses, we will update these numbers. Below, you'll see what will also be offered on our site, which is a breakdown of the budget. So we have this top line number, but what do those numbers really mean? And we break it down based on things like targeted wraparound support. So what kind of housing, employment options do you need to provide for the ecosystem to do its job well? How do you resource frontline violence prevention workers? And separate from that, the supervisors and city staff necessary to support the frontline workers. There's budget allocations for training and technical assistance, evaluation and data support, and we sum that all up. Below, you also see these top line numbers, key recommendations around what we believe at minimum should be the staffing of key functions within the frontline violence prevention strategy community. So what are the frontline workers and what are their actual responsibilities, job descriptions? So we have for each function, not only the number we recommend for the city, but also a specific job description and where it might fall within the strategies. So for example, we have HVIP, violence intervention specialists, the number, and those would often be housed within, obviously, hospital-based violence intervention, but because they're different structures, that could be housed in a hospital or in a community-based program. We recommend for Indianapolis, at least 33 street outreach workers. Those can be housed through a number of different strategies within Indianapolis, and so on. The goal here is to ensure that we are on the same page about the opportunity to grow the ecosystem, that we want to not only set benchmarks, but also exceed those benchmarks. And so we look forward to engaging this tool and ensuring that we have further information about effectiveness as time goes by. So I will conclude with this and pass things back to Anthony. We look forward to your questions and look forward to this initiative. Deeply grateful to our partners. Thank you.
Thank you for that, Fatima. And thank you for walking us through the CVI.org, CVIecosystem.org website, so folks can go there. Our next speaker, you heard me mention earlier that our work has been supported by two of our funding partners, the Barmer Group and the Schusterman Foundation. Nina has been a tremendous partner with us from the Bomber Group. And we thought it was important for you all to hear from her and from their perspective. So Nina, I want to turn it over to you and thank you for your support and thank you for being here with us today.
Thank you, Anthony, and everybody for being here. It's an exciting day. I'm Nina Ravor. I'm joining you from Los Angeles, where I lead Baltimore Group's giving in LA County and California, and also work nationally on issues of public safety. For those who don't know, Baltimore Group is the philanthropic arm of Steve Ballmer, the former CEO of Microsoft and the owner of the LA Clippers, and his wife, Connie. As an organization, we're focused on improving economic mobility and reducing systemic inequities for low-income kids and families. That means we work on things like education and child welfare and youth development and career success. But we also recognize that safety is foundational. We consider it a precondition for economic mobility. The best reading program in the world isn't going to help a kid if it's not safe for him to get to school. And we also know that gun violence disproportionately affects Black and Brown communities, and particularly young Black men. Because of this, we've supported efforts related to public safety, including community policing, alternative crisis response, and of course, community violence intervention. Baltimore Group supports CVI because we know it works. We fund CVI work in Detroit, Chicago, and here in LA, where we've seen it in action with our own eyes. And most significantly, now we're supporting the CAPS initiative. We're supporting CAPS because it's the right idea, the right organizations, and the right moment. A couple of years ago, we started having conversations with the organizational leaders here today, as well as with David Muhammad of National Institute for Criminal Justice Reform. And through that process, we learned that these key leaders who had different specialties had mostly worked separately over the years. They'd sometimes worked in the same places, but they had never been funded to work together. And they all thought they could have more impact if they joined forces. So we asked them to develop a joint concept about how to approach working in cities in a deep and coordinated way. And they did that. This initiative is the result of their leadership. So we had the right idea and the right organizations. We also have the right moment. We know that there is greater support and understanding of CVI at all levels of government than ever before, including the mayors here today. Last week in St. Louis, I had the privilege of attending a conference of the first set of grantees of the Department of Justice's Community-Based Violence Intervention and Prevention Initiative. This conference included CVI professionals, city officials, law enforcement, and representatives of the Department of Justice, including Attorney General Merrick Garland, all in the room together, all talking about an approach to public safety that, in the words of Associate Attorney General Vanita Gupta, quote, centers the very communities that are impacted by violent crime, where community members, local leaders, and law enforcement work together as co-producers of public safety. This is a pivotal moment for CVI, but the field needs more believers, more friends. To leaders in government who are here today, we ask for your partnership and support. CVI, when implemented well and properly funded, does work. To partners in law enforcement, CVI and alternative crisis response can make your jobs easier. They're meant to help you, not replace you. To my colleagues in philanthropy, particularly those in these 4 cities, please consider joining us in the Schusterman Foundation in supporting the CAPS effort, as well as a larger group of funders in supporting the CVI movement overall. We need help on things like data, research and evaluation, narrative, and direct work on the ground. And to the CVI organizations and practitioners who are here today, we acknowledge and honor your work. We recognize the difficulty, the commitment, the risk, the trauma, the leadership you carry in your communities. In one of the articles that was shared before this event, there was a reference to the W.E.B. Du Bois quote about the nation's lack of concern for the well-being of its Black residents. He wrote, "There have been few other cases in the history of civilized people where human suffering has been viewed with such peculiar indifference." I want to say to everyone on this call, but particularly to you, the people of community, we are not indifferent. To the leaders of the HAVI, the Collective, National Institute for Criminal Justice Reform, and Cities United, we are honored to support you. To Mayor Baraka, Mayor Scott, and Mayor Broome, thank you for your leadership. Baltimore Group is proud to stand beside you. Thank you.
Thank you, Nina, and thank you all for joining us for this historic announcement. And we thought it was important for us to make this announcement during Black History Month, and to really ground it in the people and the places that are experience community violence the most. So we are excited to be here. You heard a lot of amazing things, and now we want to move into Q&A with the press. So if you have a question from the press, I think Malik and Seth are going to be leading that and helping us get you into the room so you can ask your question. But I do want all the speakers to turn back on their cameras so that we can all be on together. Are we going to move folks in, Seth? Is that how it's going to be, Malik?
Yeah.
Journalists only, though. This is just for the
Yes,
journalists.
this is a session, questions from journalists only. If you're a journalist, you have a question, please raise your hand. And Seth, if you can call on the journalists and show them so that they can ask a question.
We're going to move them into this room, right?
Yep.
Okay. Are we seeing any?
Okay, do we have any questions?
There we go. All right.
Okay, there we go. We have Aaliyah.
Yeah. Can you tell us your name and who you're with, please, and then ask your question?
Yeah, hi, this is Leah Skeen. I'm with the Associated Press in Baltimore. Can you guys hear me?
We can. You perfect. Yep.
Okay. I was just wondering how y'all came up with the 20% goal for reductions in shootings and homicides. And like, if you could speak about whether you view that as attainable for all of the cities participating.
I'll start with attainability. We see that for the first 4. The other ones we bring on the number, the percentage goes down for the next 4 cohorts. So for the first, for this first cohort, we see it as attainable and based on the work that we've seen across the country. But I'm gonna turn it over to Akila to take to give a more detailed answer there, and then Fatima if she wants to join in. Akila?
I actually pass it to Fatima.
Fatima.
Absolutely. This so the simple answer is this is based on experience. We are all technical assistance providers who have offered technical assistance in cities for decades, and understand and believe within a 5-year period that this is more than attainable. There is a deeper science to this, and it has to do with our ability to adequately scale hiring frontline workers across the strategies and deploying them effectively to engage those who are at greatest risk. And so that's core to our theory of change and why we feel confident that we'll be able to attain those numbers. And I was just very proud to hear Mayor Broome name 24% reduction in Baton Rouge. The National Institute of Criminal Justice Reform, while David Mohammed, the executive director, isn't here, Indianapolis, one of our first 4 cities, 17% reduction in violence year on year. So we are already seeing movement. Thank you so much.
And just to add to that, you know, in Baltimore, Mayor Scott, where they're doing work, they've saw a 34% reduction. And then you heard from Mayor Baraka that they've seen a 60-year all-time low over the last little while. So I don't know if any of the mayors want to respond to that. We covered it? Cool. Thank you. Next, I think is Julie.
Yes, thank you so
Tell us who
much.
you are and where you're from.
Yeah, Julie Dorio with NJ Spotlight News. I had a question for Mayor Baraka, if he's still there.
He is still here.
All right, great. Yeah, so Mayor, I've actually been speaking with the Newark Public Safety Collaborative over at Rutgers, And one of the things they talked about, and I think was brought up on this call a little bit as well, that crime is really highly concentrated in this city and in others. About 5 or 6% of the city accounting for almost all of the crime. So where do you see most of those violent crimes happening, and how has that information, that data, changed how Newark is approaching violence reduction?
Well, we've been tracking that since the Safer Newark Council was started. And now we have maps in all of the director's offices and everywhere throughout the city that identifies these hotspots and neighborhoods. Even on my weekly address, Monday, Wednesday, and Friday, we turned it from COVID on Mondays to crime intervention. And we outline the neighborhoods, the exact neighborhoods where specific crimes are taking place, whether it's robbery or homicide or aggravated assault or stolen cars. We outline the specific areas. Police do deterrent intervention kind of in those areas. They do focus intervention, focus prevention in those areas. We don't just throw this a net out like we did before with the whole idea of the broken windows thing model that they found out was completely like illegitimate and wrong. We now do kind of focus deterrence in specific areas and neighborhoods. And we focus on specific people who are passed not just through the police department, but also through our CVI ecosystem. So there might be a number of young people who are repeat offenders who are having issues that also pass to the Office of Violence Prevention, as well as adults who they engage in, and community-based organizations who see them. So it is a more kind of prescriptive way that we begin to reduce violence and crime in our city, and not this kind of broad-based thing, which at its core is really about racism, and that we begin to focus our attention on those neighborhoods. So we have each neighborhood actually outlined in the city for residents and for the practitioners here. So we know exactly, just like we did COVID, exactly where it is happening at.
Thank you, Mayor.
Thank you, Mayor, for
Appreciate
that. Mayor Scott or Mayor Broom, you want to, how has that knowledge impacted you all? Anything to add to that, or that?
I would just say amen to what the brother mayor said. Amen.
Amen.
Yeah, it has certainly helped us be more effective with, focusing on really where the challenges are. So.
And I think that also what the brother mayor said too is something that, I know Mayor Broom says all the time. And it's important for folks to hear that when we're all together, that we all have the same kind of approach, learning and understanding that we have to focus everybody on what's the most important, right? You heard from the brother mayor that you focus the police, not just in the areas, but on the people that we know, right? And that's the importance of this work, not going back to, as he said, broken windows theory or what we had here in Baltimore when I was growing up that I called breathing while black, right? If you lived in my neighborhood and came outside, that meant, hey, it was your time to sit down on the curb. And that the way this new enlightened non-racist approach that we have here will allow us to have a much deeper impact.
Thank you for that, sir. I'm gonna turn to James. James, can you tell us who you are and who you're with, and before you ask your question?
Yeah, thank y'all for having us. My name's James Finn. I'm with the Advocate in the Times-Picayune in Louisiana. I have a question kind of for Mayor Broom, but also for the other mayors, if you'd like to chime in. Mayor Broom, in Baton Rouge, we've had, like you mentioned, like a 23% drop in fatal shootings year over year. And I wonder if that extra 20% drop that y'all are shooting for with this partnership is attainable given the kind of drastic drop we've had over the last year. Just because I know some officials are, we obviously made some great strides in the past year, but keeping it down and getting it down further seems to be a challenge considering how far we've already come.
Good question. I will say it's always a challenge when you're doing this work that's not for the faint of heart, especially when it comes to public safety. James, I will tell you, I think that there are people who are amazed at the results that we had in 2022. And I think we would be remiss if we did not continue down that trajectory of the strategies that we have used to reduce our homicides and our non-fatal shootings in Baton Rouge. You know, this morning I got an important piece of data as well, and you can confirm this with Chief Murphy Paul. I asked him over, but he told me that we're down 70% between January and February, where we are now in 2023 compared to 2022. So that speaks volumes to me in terms of the possibilities. And I believe as we continue to utilize these tools and this collaborative and our collaborative strength, if you will, with our partners, that we can, albeit challenging, see continued reductions and elevated safety in our community.
Thank you, Mayor. Any other chime in?
Can I ask one follow-up question?
Yes, go ahead, James.
I was just wondering where funding for these programs was coming from.
From our work or from at the local level?
From the work that y'all are proposing at the local level, I guess.
Yeah, so we, as you heard us say, we have funding from the Bomber Group and the Schusterman Group, Schusterman Foundation, and we're coming in to support our work, but also have some resources to do some re-granting. But also, if you heard all the mayors say, they have used ARPA dollars and general fund dollars and local philanthropic dollars to support their work. So I think, the question is, if we're finding it in multiple places and looking for federal dollars that are coming out to support this work. So we're all trying to pull all of those resources together. And as you heard, to really focus on those who are most at risk. So when we bring those dollars in, we still want to make sure that they're connected to this ecosystem and the strategies that you heard all the mayors said they have. I think Akila came off.
Yes, sir. Just wanted to also just make the important point, and Mayor Baraka talks about this, often when they talk about the 7 consecutive years in a row of decreases of homicides and violence in the city, that this didn't happen overnight, right? We've been working in these cities for years at this particular point. Right. The mayor has invested, Mayor Broom has invested in community-based public safety or CVI strategies for the past 3 years that we've been on the ground in that city. Mayor Scott, NICJR has been in Baltimore for years. Right. The mayor, as soon as he became a Baraka in Newark, 2014, the Safer Newark Council, 2015, the launch of NCST, these are ongoing strategies, and we believe that we can actually get to zero. I mean, as you saw that Fatima presented, violence is concentrated in cities. In a place like Newark, 80% of the city experiences literally no violence, and we know that it's because of neglect. And these old systems that have been in place that have been ineffective in terms of addressing violence as a public health issue. And so this coordinated strategy complements our existing law enforcement infrastructure and works through a public health frame, so that we know that engaging residents, utilizing relationship-based strategies to address the underlying issues, which is trauma and poverty, right? As well as identifying, those individuals. The national data says that 2% of the population is producing 80% to 90% of the harm in cities, right? So we have technology now. We can identify that small percentage of individuals who are producing violence and provide the wraparound services and support, and then also utilize our law enforcement system through, targeted deterrence, to address those other issues, right? And be able to move our cities to zero, right? Because we believe that this is possible.
Thank you for adding that, Akila. I think we got time for 2 more questions. I'm gonna go to Chip and then Drew and Jessica. If we have time, I'll pull you in as well. So Chip, tell you who you with as well.
Yeah. Hey, it's Chip Brownlee from the Trace. I had a question for the mayors. Could you all speak a little bit more to specifically, what some of the immediate plans are for the grant funding that you're getting and the initiative in these cities? I guess I'm asking, how do you see this playing out in the near term? And what's changing from your previous work with members of the coalition?
Can we start with Mayor Scott and then Broom and Baraka, if there's
Yeah, so for us, listen, when you talk about this money that we're putting out, we're doing this in a way where we're in that work, right? The work that you heard me talk about, expanding our hospital-based intervention, looking at expanding the work that our Safe Streets workers do in Baltimore, trauma and our trauma services work that is now just starting, right? We're starting that work now. Those are immediate things. I think that sometimes we fall into this trap where folks talk about CVI and don't think of CVI as immediate. It absolutely is an immediate and a long-term thing. When you have violence intervention workers out there intervening in something that could have been violent, that's an immediate thing, right? It doesn't, just because they also are going to then try to pull those folks in to see whatever resources we can hand them off to, doesn't mean it's not an immediate thing. This work and the funding that we're putting out and offer and all these other things, it's going to these folks in communities like the brothers at We Are Us, who are out there every day in communities, walking around, going in, seeing violence, pulling young brothers and sisters off of these corners and getting them into our informant work, the work that we're doing here with our most at-risk young people in opportunity. All of that work, it is immediate work for us. It just also happens to be at the same time work that we're going to do in the long term as well.
I will chime in and say that our plan is similar for these grant opportunity dollars to expand our neighborhood community areas and outreach, to continue to elevate our strategy meetings with partners that are on this call right now, establishing community hospital intervention, because we've talked about looking at public safety through a health lens, and of course, working with our community stakeholders once again, and building public safety infrastructure, if you will, within our city.
Thank you, Mayor Broome. Mayor Baraka.
Yep, I would echo Mayor Broome and Mayor Scott. I mean, really, it's like, usually we use money to expand the police department. And we do that with city taxpayer dollars. And there's really no question about how we use the money. People know we're gonna add more police officers, and that takes money to do that, right? For taxpayers' money, we usually raise people's taxes and get a COPS grant from the federal government to do that. What we're trying to get people to understand is that the things that we see are working, that we're going to use the resources that are being given to us to expand on those things. So not just expanding the police department, but we expand hospital-based intervention. We expand, NCST or other organizations that are doing the work in the city. We expand the things that we know have been successful and give organizations the resources to not just do work in one neighborhood, but do work in multiple neighborhoods, and not just have a trauma center in one community, but have it in 2 communities. So if we identify 3 neighborhoods and we only have resources to put it in 1 neighborhood, then obviously we need more money so we could put it in 3 neighborhoods and not 1, in order for this thing to have a larger strategy. So the question was, can you reduce? You asked the incredible mayor of Baton Rouge, can she go 20% lower than that? Well, she needs more resources to be able to do that, right? That's what needs to happen. If she gets the money to do that, then she can focus that on a larger part of her community.
Thank you, Mayor. Go ahead, Fatima.
I just want to plus one that point, Mayor Baraka and Mayor Broome, Mayor Scott. The reason we developed the CVI ecosystem.org website is to allow mayors to have something concrete to then share why, right? The case for why this funding is necessary to have the kinds of outcomes that you're hearing on this call. It requires ongoing resources, sustained resources, just like you would fund ongoingly a police department, a school system, a health system. You need it every year in order to have the impact. But it has to be data driven. And that's why that theory of change is critical and why we are seeing such powerful impact here. We believe in our theory of change. So I just wanted to put that out there and I'll return it to you, Anthony.
No, appreciate that. Thanks for making that final point. I know we said we're ending at 1, 2, depending on where you are on the in the country. But I do think we have 2 more questions. So if folks can hold for those 2 questions, cool. If you got to bounce, we understand. But also those who didn't get that ask a question, I think in the press packet, Malik's email is in there. You can send him an email with your question and we'll make sure we get that answered. But I'm gonna go to Drew to ask the question. Drew, tell us who you are and who you're with.
Sure, I'm Drew Lindsay with the Chronicle Philanthropy. Question perhaps for Nina, Fatima. There's been a lot of interest by national philanthropies in CVI. I'm curious about the challenges in getting local philanthropies to come on board, local foundations and donors. I know there's some in Newark, some other places, but what is the challenge in bringing them on board?
You want to start us up, Nina?
Sure, and thank you for the question, Drew. There is a lot of interest nationally in CVI, which is tremendous. And I think with the local places, it really depends on where. You know, in a city like Chicago, philanthropy has really been leading the way in lifting CVI approaches and actually helping to advocate for public funding. And in places like Los Angeles, as you may know, philanthropy was really critical to starting the CVI approach that was originally started under Mayor Villaraigosa, then Mayor Garcetti, and now Mayor Bass, where there's been tremendous, public and private buy-in to this approach. So it's hard for me to speak about the local philanthropies. I'd actually defer to the mayors as well as the organizations who are working in some of the other cities. But there's definitely, growing and significant interest in the part of a number of national funders.
Yeah, just to add to that, Drew, and then I'll open it up. I think just to Nina's point, there's so many, again, community foundations and local foundations are also on the front line and they feel this. They have been supportive. I think you see a lot of philanthropy and local coming in when they see a strategy and a plan and can see themselves in that plan. But I think too, one of the reasons we all work in partnership with mayors and other local elected officials is because they get to bring those tables together and really help people see how and where investment needs to be. And so folks can see themselves in the work, right? So, we do a lot of work across the country and we start a lot of our work with foundations, community-based foundations who are asking that question. As Nina talked about, the Minneapolis Foundation has been really at that table, the Community Foundation of Louisville, Greater Buffalo. So there's a good number. So I don't know if it's hard to get them in. I think it's like how you keep them at the table and how you keep them engaged. And I think we have been doing a better job at explaining what community violence intervention is and how people can be a part of it, because folks just didn't see themselves in it for a long time. But if you look at it as a public health approach and a public health crisis, people can really start seeing themselves in the work a little bit more. I don't know if any of the other mayors or Fatima or Akila wanted to add too.
Yeah. Go ahead, Fatima.
Add just, Anthony, you picked up on that point. There needed to be a narrative change in this country about what community violence intervention is. I think that violence for a long time has been sadly neglected because it's been seen as a political issue and a politicized issue in many cities. And through this health approach, enacting safety through a health approach has been a winning message everywhere. It brings people from all walks of life, no matter your political affiliation, to the table. And when people see results, they are moved. I think that's a huge part of it. Doesn't lie right within people's existing philanthropic portfolio. We have to get creative, and people might have a youth portfolio, they might have a jobs portfolio. This traverses all of that. We can't get to excellent schools and education if our kids are fearful walking down the street, right? We can't get to job and economic growth if folks are being shot, right? I mean, those are the realities of communities that have been disinvested through structural racism for hundreds of years. This is the opportunity to transform all of that at once.
If I may add, thank you, Fatima, for making that point. And if I may add, in addition to the narrative, and that is something that we need to continue to work on for sure, to be able to explain what this work is and isn't, so that folks who are not as embedded in it can understand. The other piece is that we are, and this is a really a role for funders as well, is around having more and more proof points to be able to show that this work works. You know, we do have a couple of very specific randomized control trials of particular models. We've got, you know, obviously, you know, some tremendous successes in particular cities, as you've heard about, and as well as other approaches. But to be able to build a critical mass of that kind of evidence for people who want to see that, need to see that, in order to help unleash more public support and public funding. But also understanding that it is not easy to evaluate most of the work that we're talking about here. You're talking about work that happens deep in community with people who are not necessarily trusting of institutions or of researchers, and of researchers who may or may not understand what is required to get work done and to get credibility in the streets. So, you know, we all have to think about various ways of assessing and learning about the work, and understanding also that this is a field, as other speakers have talked about, that has been underinvested in, not invested in for decades. So to assume that we're going to put some money into CVI and in a year everything's going to be fine is not a realistic expectation. And that's actually a role for philanthropy as well as government, is to help build that evidence base and the narrative so that more folks understand what this work actually is and the difference that it's making.
Thank you for that, Nina. Appreciate that. I'm going to wrap us up and close out. I want to thank the mayors for their commitment, for their partnership, and for their leadership. I want to thank you, Nina, and the Baltimore Group and Schusterman for trusting in us and believing in us. But I want to thank my partners from the Fatima and Akila and David, who is not here, for taking this journey. Right? We're going to go on a 5-year journey together to really do this work in partnership. And we believe this is the only way that it gets done. So we're just thankful for the folks who joined us today. Thank you for the questions from the media. And we look forward to updating you all on the work as we continue to move it forward. So thank you all for joining, and thank you all for your support. Have a good day. Thank you.